Hello, everybody, and welcome to another interview with one of our awesome speakers for our upcoming event in Mallorca in November, the Low Carb Universe 2019. Today, I have the pleasure to speak a while with Dr. Evelyne Bourdua-Roy, je crois. Welcome, Èvelyne.
Hi.
Hi, how are you?
I'm great. How are you?
I am just fine. I'm so glad to be able to speak to you. It's nice to have this little meeting before we meet in real life in November in Mallorca.
Absolutely.
Èvelyne, please tell us a bit about yourself, about your work, where you live and so.
I'm a family doctor and I work in the province of Quebec in Canada. I'm just outside of the city of Montreal. And I've been a family doctor since 2015. I used to be a French, Spanish, English translator before that.
Oh.
And I just had this feeling that I wasn't making a difference with my work every day and it was all meaningless to me. So I applied to med school and got in and became a doctor and chose family medicine because I wanted to be first line and have the opportunity to develop like a relationship with my patients. And so I graduated in 2015, started working as a doctor thinking, now I'm going to make a difference. It turned out to be a little disappointing for me because I ended up seeing a lot of chronic illnesses for which I was taught to prescribe pills and more pills and more pills. And my patients were not getting better, they were not getting healthier, and they were gaining weight, they were getting tired and chronic pain and all that. And it seemed to me that, wow, did I do family medicine? 9 years of my youth, wasted. But I was pregnant at the time, and then I took a maternity leave to have my second baby. And during that time, something absolutely amazing and life-changing happened to me. I got in touch with some Canadian doctors, amazing ladies who told me about low carb, about ketogenic, about intermittent fasting. And they told me to read Obesity Code by Dr. Jason Fung. And I was breastfeeding at the time, not sleeping very much, not at all in my memories. And so I read the Obesity Code and I had, a life-changing moment, a light bulb moment. And I thought, wow, how come I just finished school and I never was taught any of the information inside that book? But, sometimes things sound really good on paper. And then when you try them out, not so much. I decided to try it out on myself because I had some weight to lose and I was so tired from not sleeping. And so I decided to try low carb and see what happened. And immediately, like within a few days, the energy I felt was much better. I wasn't sleeping anymore. I was still breastfeeding every 2 hours. But I felt better. I really felt better. I felt my mood swings, were lessened. And I had this energy all of a sudden. So I kept on reading more science articles and more. And I just thought, oh my God, like there is really something to this. So maybe I could offer this type of medicine to my patients and finally make a difference and, help them for real this time. But as you all know, we don't learn that in school. So I didn't want to do harm. I didn't want to, I wanted to do this properly because in my case, I'm not taking any medication. It was just energy and weight loss that I was after. But my very sick patients who take a lot of medication, well, you just can't improvise that, or at least I didn't feel confident to just try. So I wrote to Jason Fung and Megan Ramos and I said, can you teach me to do this medicine, please? And they said, yeah, come on over. They're very generous like that. They always, as far as I know, they always invite observers to come and learn this medicine. And so I went, learned how to do this safely and properly, and saw so many patients getting better, coming in smiling, coming in, you know, proud to tell Megan that they had lost another 5 pounds, 10 pounds, that their blood sugar levels had gone down again. It was amazing. It was so amazing to see patients coming to a medical office and getting better.
Yeah.
And so I was completely stuck at that point, because I definitely could not unlearn what I had learned and could not unsee what I had seen. So for me, the only way forward, if I wanted to respect myself as a person and as a doctor, the only way forward was to offer this officially to my patients. So in January 2017, I created a low carb clinic, and which is called Clinique Reversa. And we are pretty much the only one of our kind in the province of Quebec. So we get patients from all corners of the province to come to our clinic for a 6-month program where we help them reverse their chronic conditions such as type 2 diabetes, obesity, metabolic syndrome. But more and more, we're seeing chronic pain, chronic fatigue, like fibromyalgia type of pain and fatigue. We see obviously a polycystic ovarian syndrome. We see a few patients with cancer, but I'm not really well versed on cancer and ketogenic diets. Other people do it way better than I do. We are seeing eating disorders more and more, a food addiction more and more. So this is becoming it's wider than I thought when I first started the clinic. I thought I would just see type 2 diabetic patient lined up at the door waiting to be reversed. But it's doing great. We've treated over 1,000 patients so far, and so we're doing great with that. The clinic is really doing great. We have branches in different cities now with different doctors joining forces. So we're expanding, and I was asked to collaborate into a book, because there's a lot of information out there. Just thinking the Diet Doctor website and all those great books that have been written on the low carb, ketogenic, intermittent fasting, and not a lot of them have been translated into other languages. And French is one of those languages that is not so lucky. We have Dr. Fang's books, but not so many other resources in French. And so I wrote a book with like, you know, low carb keto 101 for people. So the first part of the book is just information. How does this work? What is low carb? What are carbs? And stuff like that. And the second part of the book is recipes. And it took me about maybe 2 weeks of full time to get this book together, which was a big bet, because at the time no one in Quebec had heard of low carb, ketogenic, and intermittent fasting. So I was hoping to sell at least 6,000 copies so that I would break even with the costs. And last time I checked the numbers, I think in April, we had sold 50,000
Wow.
copies. Yeah.
Congratulations. Oh, what a thing. That was awesome. So obviously the Canadian people like really eager to get all this knowledge about low carb.
Yes.
But the Canadian authorities, how do they agree with the way you and your fellow doctors low carb treat your patients?
Well, Jason Fung was probably the first clinic established in Canada, as far as I know. And since then, I think we're probably like at least a dozen of clinics all over Canada. In each province province has a low carb clinic. And so we've all been doing our thing. And so far, not so many people had problems with the authorities. Now it's in Canada, it's divided by province. So in Quebec, we have the College of Physicians of Quebec. And in my province, it has been problematic a little bit. I myself got into trouble, and I got 2 official complaints with the college for the type of medicine that I choose to do. And It was a bit tough, I got, you know, but in the end, to make a long story short, in the end, they agree with this type of medicine that we. And it's a good thing that they agree now that the American Diabetes Association came up with their 2019 guidelines that include low carb as a therapeutic option. Yeah. Well, now I don't think doctors will have much more problems anymore practicing this type of medicine.
No. Do patients know about, or do people know about what you do and they contact you because of what you do? Is there an awareness among Canadians with the metabolic syndrome and diabetes and so on? So they contact you themselves?
Yes, patients contact me all the time through my website, but mainly through Facebook or Messenger or Twitter. I find that the fact that my book sold so many copies is great in itself, because it shows people are eager to find this information and to use food as a therapy, as a medicine. And it all makes sense to a lot of us that food should be the very first treatment that you try if you have illnesses of any kind. Yeah, and absolutely. Yes, food first.
Yes, food first, of course. Real food first, of course.
Absolutely. Yeah. Lifestyle habits, you know, and all that. Yeah. But so I do find that a lot of people are searching for, how come I'm getting sicker? How come I'm getting fatter? How come I'm not feeling great? They're looking for answers, but I'm not sure everybody yet knows that low carb, for instance, is a great treatment for any metabolic issues like metabolic syndrome or type 2 diabetes or obesity. I think the word is spreading, but because it's sort of a grassroots movement and it is sort of word of mouth, like somebody gets better and they tell their, you know, their friends and neighbors and family members, they get better, they tell others. So there's a ripple effect that is happening, but it takes time.
It surely does, yeah.
And as long as the authorities are not talking about it and supporting it, and it's not all over the newspapers and stuff, it's harder to really educate the population at a higher level.
Yeah. My impression after all these years in the low carb community is that professionals like doctors and nurses, those of them who treat people with a low carb, with dietary advices in the low carb sphere, they have started doing it after trying it themselves, like you did. It's like they have to find out for themselves with their own bodies that this is something really super awesome to use on the patients. What do you think is needed? What can be done to get all the other doctors to understand what you and your colleagues in the low carb business have discovered already?
I think creating like conferences and workshops with continuing medical education credits is already like a step in the right direction, a step forward, because if it's recognized as being worthy of credits, you know, then it seems to be more efficiently recognized and supported. So most doctors that I know that are low carb themselves, that are teaching it to their patients, also try to teach other doctors and other healthcare professionals. And so I think we're each doing it on our own, but I think if we had more organized events, it would help.
Yeah, it sure would, and we are trying to do what we can. So, and that's really interesting, because the Low Carb Universe was the very first international low carb event in Europe, and we attract both normal people, everyday people, and professionals. So, and also vets. We had a vet coming, so there's spreading around in all ways, all the different ways we can do it. It's a step in the right direction. So yeah.
Absolutely. What is great about events like yours and people coming from all walks of life is that you get different people with different ways of thinking, you know, like just think about all the engineers in the low carb sphere. They have brought like Ivor Cummins or Dave Feldman. Yes, and Dave Feldman, the way they think is different than the way healthcare professionals think, because we've been taught a certain way of seeing health or seeing food, diet and stuff, and they come with different perspective, and that's really enriching the knowledge and the way we talk and discuss it and what we look at.
Absolutely.
I love events like yours for this opportunity to have different people, like even normal people. Yeah. They're not officially healthcare professionals, but you have a lot probably of very knowledgeable people who are helping.
They are. They have, and it's so interesting. And actually, it's been like guests we've been having on earlier. Actually, invited them to speak at other events. So we find the guests, even if they don't come back and speak, they know so much, and the dialogues and the discussions you can hear. And everybody is so open-minded, and they are so eager to learn from both speakers and other guests, of course. So the atmosphere is, and you know, like it's 24, not 7, but 5. So it's so very intense, and you can really tell that people coming there, they are so interested, and they really want to get as much as possible out of these 5 nights and 4 days, and they do get it. So, and it's so interesting to see, because we also, one aspect of arranging the events is also that we want to build a stronger low carb European low carb community.
Yes.
Because it hasn't been as strong as it is in America, for example. And we are seeing that people are, former guests and speakers, they are having projects together, they are keeping in touch. So we're coming there. We're getting there as well. So we do hope that we will spread all over Europe with all the knowledge and everything. So one question, have you been to Europe before?
Oh, yes, I have.
Yes, have you been in Spain?
Yes, I have.
Okay.
But not in Mallorca.
Yeah. Okay, this was the first time, and you're going to love this island. So you told me a bit just earlier, but what are your expectations for the Low Carb Universe 2019?
Seriously, I just want to be part of this community, learn as much as possible, network with people, meet all the awesome people that will be there, all the normal people. You and I are normal people too, you know, like meeting everybody that is interested and that wants to contribute and that wants to discuss it. I want to talk about low carb and keto and intermittent fasting all the time, and my husband not so much. So this is going to be a great time. I'm just so honored to be invited to speak at your event, and I'm really looking forward to talk with everyone, mingle with everyone, and just bathe in the atmosphere. I know it will be awesome, and I might be coming every year after that.
We would love to have you. And we are so honored that you wanted to come and be a speaker. And if you want to learn a lot of things from Èvelyne and all the other awesome speakers and guests, you should go straight into www.lcu.thelowcarbuniverse.com, and there you will find all the information and the tickets that you need to buy to be part of this very awesome event in November. So thank you very, very much, Èvelyne, for taking time. It was a true pleasure to talk a bit with you, and I'll see you in November.
Thank you for having me.
Thank you. Bye-bye.